Welcome. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber. I want to thank you for joining us this week for the Retail, Personal Services, and Limited Healthcare session. It is the last week that we're going to be doing it in this particular format, which Jesse will cover later in the presentation. But we will continue to have opportunities weekly for you to tune in, get updates, ask your questions, and provide feedback. Don't stop that. It's all important for us to learn the safe reopening practices, what's going on in our community, so we can become better employers and better businesses that for our customers and our employees. At this time, I'm going to hand it over to Jesse Rounds, but anytime during this, if you have questions, please put them in the Q&A or chat, and I'll ask them on your behalf.
Thanks, Corinne. Let's just jump right in. So I'm going to go over a little bit of our long-term outlook as we have over the last couple weeks, then dive into some detail about the public health orders and mask orders and some research that we've been looking at about masks and face coverings. Then we'll get into some resources and jump as quickly as we can into sector-specific information, recognizing that that's a lot of why people are here. So first up, I just want to reiterate that the public health orders are with us for the long run. It's going to be months as opposed to weeks, and we've been saying that from the very beginning. And that's because there is no vaccine, there's no treatment, and we don't have herd immunity. And COVID-19 is just as dangerous as it was in January and February when it first got here. And so we are trying to, the governor's public health orders are really intended to protect the community. In terms of the epidemiological update, instead of sort of going over what we've seen lately, and I'll just say that we are continuing to see a downward trend in new cases with some variation over short periods of time, but that's mostly after that large spike we had a couple weeks ago. What I really want to focus on this time is how we're dealing with sick employees or outbreaks at your business. And I just want to encourage you, Boulder County Public Health and the state issue protocols about how to deal with this. And we will work with the employee and with the business in order to protect employees and customers. And one of the things that we've been hearing about, and the reason I wanted to bring this up, is that employers are requiring employees to get additional testing after they have tested positive, after they've isolated and no longer have symptoms. Some employers have been requiring employees to get tested, and that results often in a delayed return to work because a person who is infected with COVID-19 will continue to have a virus in their system for some time after they are no longer symptomatic, they no longer can transmit the disease. They're healthy, but there's dead virus or there are parts of viruses in their body, and the test picks those up. Then you're in a situation where your employee can't return to work, so you're just delaying their return and a return to getting their help around the office. So if you follow the protocols, your employee can return to work after isolation and when they have no more symptoms. So in terms of where we are with the public health order, we are still in Safer at Home within Boulder County. We're in the 8th revision of Safer at Home, and we will remain in Safer at Home for some time. Protect Our Neighbors has started, and there are communities that are applying to enter Protect Our Neighbors. We are not one of them. So we are going to continue to stay in Safer at Home, and I'll get into a little of that in a moment. And really that's, Protect Our Neighbors is you must apply to enter Protect Our Neighbors, and you have to meet certain criteria. And because of the outbreak we had in June, we still do not qualify to enter Protect Our Neighbors. We don't know when we will qualify, and we are hoping that we will see positive trends that will allow us to apply at some point. But until then, Protect Our Neighbors, it's a state level program. Each community, and in this case that's the county, would apply for that. And if accepted, then we could move into that phase. And we can, if and when that happens, we will definitely reach out to the business community with details about that. And since we're still in Safer at Home, I think it's really important to really hammer the importance of measuring risk and understanding risk. When you do activities outside your home, you are taking on various levels of risk, and being aware of that allows you to understand how your behavior needs to change to protect both you and your community. And so we really want people to think about at what level most of their activities are occurring. And one of the great ways to reduce risk is to be active outdoors. And that's not just exercising or going for hikes or playing outside. That's any number of activities. And that's because being outdoors has a much lower likelihood of COVID-19 transmission. These numbers are not as important as just the general idea that being indoors is much more, it's much more indicative of contracting COVID-19. This is from a study, it's a single study that has not been peer reviewed, but it does reflect the general impression that we've been receiving from experts that outdoor activities are much safer than indoor activities in terms of transmission. And so that leads me to the sorts of things you can do outside, whether that be business meetings and breaks with coworkers that are outside, or whether that be special events like ceremonies or movie drive-in movies. These are all opportunities for the community to get outside and have some of the normal things that we all are used to, but in a physically distanced and safer way. In terms of other things we can do, face coverings are really important. Along with social distancing and hand washing, face coverings are an important part of protecting the community against the spread of COVID-19. Wearing a face covering also sets a good example for our neighbors and our friends, and it helps protect vulnerable populations throughout the community. Boulder County does have a face covering order, and it has been extended indefinitely by the public health director. That face covering order requires that if you are inside a business, you wear a face mask. If you are outside your home, and you can't maintain physical distancing of 6 feet, you need to be wearing a mask. And so we're really encouraging people to carry a mask with them all the time, at all times, and often wear a mask because you don't know whether you're going to be able to maintain 6 feet of physical distance. And so it's just easier to have it on. In terms of businesses, we want to encourage you to review the face covering script. We know that there are businesses that have had a number of customers come and say, I don't want to wear a mask, I can't wear a mask, but still want to be provided services. And the face covering script is a great way to sort of review and explore the different ways that businesses can provide services to those who either refuse or cannot wear a face covering. Just a little bit more about face coverings. This is from a study by Goldman Sachs. They did sort of a statistical analysis of various face covering ordinances at various levels in various countries. And they recommend that face covering as a good substitute for renewed lockdowns would avoid a significant impact to the GDP that a renewed lockdown would have. So just taking the small step of wearing a face covering has that much larger impact on the community. Another study, just to help visualize the value of face masks. This is a very recent study that came out. Again, it's just one study, but I think it really helps visualize the impact of face masks. And what they did was they used a sort of an interesting background with some lighting to show how a cough moves through a space. And they did it without a mask and with a mask. And without a mask, you can see over a period of time, in 2 seconds, a cough, an unobstructed cough moves 3 feet. And that compares to with a folded handkerchief, which is maybe one of the simpler masks. In 2 seconds, you're really looking at a foot about from your face in terms of what's coming out of your mouth. With a homemade mask, it's stitched together, multiple layers, that sort of thing. Within 2 seconds, it's barely past the mask. And so much more protectant. With a commercial mask, you're noticing there's almost no leakage. And in fact, it improves because there's very little leakage around the sides of the mask as well. And again, this is just for visualization purposes. We're not saying that this is a definitive study. We are not airflow scientists that can really get into that sort of thing, but I think it's indicative of what we're seeing out there in the press and in the scientific community. Just switching gears pretty significantly, just want to again highlight information sources. Both the county's website and the state's website have a ton of information. Our county website has begun linking to more outside sources as opposed to producing our own information. That's really just intent on trying to improve the, trying to decrease the amount of sort of confusing information out there. If we all point to the same stuff that we all agree on, then it'll be much easier to find information. With that, I'm going to switch gears completely to limited healthcare and personal services. I'm going to do these together because they are tracking each other in both in terms of guidance. There have not been changes in guidance in quite some time. And the one area where that is not true is, I'll get into it a little bit, but the one thing I really want to recommend to you is if your industry, whether limited healthcare or personal services, is licensed through the Department of Regulatory Agencies at the state level, please go to their website. They have industry-specific guidance. They've interpreted what the Colorado Department of Public Health and Environment have said and matched it with that industry's national level guidance as well. And so I think it's really helpful to go to the DORA website to check that out. In terms of Q&A, we're continuing to get questions about mask wearing, and that's where one of the changes has occurred. In terms of the general guidance, both in limited healthcare and personal services, you must wear a mask at all times, and customers must also wear masks at all times while in the business. Within limited healthcare, those employees must wear medical grade masks, whereas in personal services, the materials and type of mask are not specified. And as I mentioned, there was one change, and that is that in the past, previous to the eighth revision to the order, no services could be performed on customers if it required removing their mask. and that has changed for both limited healthcare and personal services. You can perform services where the customer removes their mask, but the practitioner providing the service must wear a face shield, and the face shield must be cleaned between uses. And while you're wearing a face shield, you must also be wearing a mask. So there are details about that specific to industries in the DORA guidance, but I wanted to really highlight that because it's been an ongoing question from both limited healthcare and personal services businesses. And with that, I'll turn it over to Ambra.
Thank you, Jesse. So just wanted to give you a couple of resources. There hasn't been any changes in the guidance for retail, but just really wanted to highlight a resource from the CDC, which has the recommendations for retail workers and employers. And so you can find it here at this link. And then next slide, Jesse. I just wanted to highlight, there were some questions on where you can find shields and screens. I had spoken to a couple of critical retail businesses that didn't have the shields or screen up. And so I had sent them over this online supplier guide. This was just a list that I had Googled and found. And I think Corinne had also given me a couple of local resources as well to add to this list. But basically just wanted to share, you know, a few of these where you can find them. You know, most of these you do have to order and it takes about a week to come in. But the good news is people are finding supplies of these at some of these locations, so that's good. And then you can also do a Google search for sneeze guard or plexiglass shield, and also check restaurant suppliers. But just to note, you know, these are required for all retail cashier areas, and anytime you're having any face-to-face customer interaction in a payment sort of way. So just wanted to share those. Thank you for listening.
I was on mute. Corinne mentioned this earlier, and I really want to highlight it. We are transitioning away from the industry-specific webinars on Tuesdays. We're now going to have a single general update and guidance webinar on Wednesday at 3 p.m. And then at 4 p.m. we'll have a special session if there are any specific industries that either we've received a lot of questions over time and we want to dig into a particular issue, or if there's a major update for an industry, we'll go into that. And I really want to encourage you to continue to attend the general updates and guidance webinar. We are going to keep on providing updates about epidemiology. We're going to keep on providing updates about the situation at the state and local level. And I think it's really important that you keep up to date on that. And I also want to encourage you to continue to ask questions. If it's a very specific or technical question, we may ask that we can answer it offline or by email. But this is still the best way for us to hear from you so that we can target our information most successfully. And then I also want to mention that the Spanish language session will also continue. It'll it'll be a translation or a repeat of the general updates, and it'll be released as soon as that translation is done. And at the same time, we will be working with the Latino Chamber. If there are specific issues that need to be addressed, we can definitely do that during that session. So please continue to attend and listen in, and we'll continue answering questions. And with that, just a reminder, this is our email address. I should have changed this slide. I apologize. Our office hours are now, our call center hours are now 9 to 2, and that will be for the foreseeable future. If you have a complaint, you definitely can call that number. If you have a question or want some clarification, definitely email us. That's the easiest way to get a hold of us at that covidbiz@bouldercounty.org email address. With that, happy to take questions.
Okay, thanks, Jesse. So I'm gonna have Amber answer the next one, but Jesse, if you look in the Q&A and pre-read the question I'm gonna ask you in a minute, that'd be great, just so that you can get up to speed on that one. So as far as the plexiglass goes, we did get another resource called 1800shield.com. Apparently it's Colorado made face shields face shields and shipped super quick. So it might be plexiglass and face shields. And so I wanted to put that out there for people to know about. Also on the plexiglass, we've gotten some comments that, what's the purpose of the plexiglass if people are looking around it or, not using it or going to the side? Can you explain a little bit about the purpose of the plexiglass and what are best practices when using plexiglass?
Sure. So basically the plexiglass is really providing that barrier for, face-to-face interaction. So thinking about, somebody's probably not able to social distance for payment, or if, they're asking questions when they're, chatting with the cashiers. So that really provides that extra layer of protection between, two people. It's, we'd completely discourage, looking around or looking under the plexiglass, but is really there for the protection of both parties. And so that's why the state made it a requirement in those cases. I have seen some really, creative ways of doing it out there. Recently went to one shop that they had just basically a glass window with a beautiful frame on it that was hanging. So there's definitely, you don't have to go with the standard plexiglass either. That's just, plastic sitting on the countertop. There's definitely some creative ways that you can, find to cover the requirements.
And plexiglass does not replace masks, correct?
Mm-hmm.
Okay, so you still need both. And as we saw from Jesse's slides, particles are still getting out when you're wearing a mask. So this is because you're within 6 feet of somebody, protecting you during that transaction time.
Exactly.
Okay. All right, Jesse, you ready to answer the question that came in via Q&A?
I am.
Okay.
So do you want me to ask it? Do you want to ask it? And then
I can ask it.
Okay.
It says the DORA changed on July 9th for massage therapists to allow for removing masks while clients are in a prone position in the face cradle, not for the client comfort. Is BCPH or Boulder County Public Health guidance stricter, or would you still require a mask during this time? I'll ask that first part first.
No, that's a great point. If CDPHE and DORA have changed the guidance, then Boulder County is not stricter. We are following CDPHE and DORA guidance. So if they're allowing customers to remove their masks, then that is allowed. And to answer the second part of the question, which I guess you should ask because no one else read it, I read it.
So the second part of the question, is there any generalized reason why a practitioner could not continue to require masks while client is prone?
No. We definitely, if the practitioner or the business wants to require stricter guidance, wants to make sure that everyone continues to wear a mask, you are more than welcome to do that. Do what, and I think if you feel like it's a good idea, you should do that. You can be stricter, you just can't be not as strict.
All right, Jesse, I'm going to ask you to turn off your camera. You're going in and out again on us, so we'll have you turn off your camera.
And my video connection fell down. Sorry.
No, It's okay. We know your broadband's been a little iffy today.
Yes.
So we're going to go back to the plexiglass, Ambra. So someone said in their experience, the reason people look around the plexi shield is because the credit card machines are often to that side, and that businesses should consider that when placing the plexiglass shields, not to put the credit card machine around it or not to provide a reason to go around it.
Right.
The other excuse I've heard is that it's really hard to hear through 2 masks and a plexiglass. Sometimes, the conversations, you might have to encourage your employers to speak up a little louder, and so forth. Jesse, did you have anything else to add?
Nope.
Okay.
Nothing there.
All right. So this question comes up every time in the retail call and the personal services. Do we see an end to taking symptom screenings in the near future?
No. Trying to learn how to be succinct. The reason that there are symptom screenings is that there is still virus out there. People are still getting sick, and one of the best ways to stop the spread is to limit interaction between people who may have the virus and people who don't have the virus. And so symptom screenings are a really good way to limit that interaction, and also a great way to track who's coming in and out of your store, and what, if they're not feeling well. It's just a good way to stop, pause, everyone take a second and say, hey, is this a good idea? And so until there are treatments and a vaccine, we're likely to continue to see symptom tracking for employees, definitely.
All right, you might know what question I'm gonna ask next. It's hot out. It is, we're experiencing 99-degree weather outside, and so when people walk in, they might be reading a 99.4 because they're hot from walking in or being in our heat. What are some best practices, and what do you need to do, and what's that level that you need to say, okay, you can't come in for accommodating to the heat?
So I'm going to get this right this time instead of transposing numbers. It's 100.4 is the cutoff above which you should not let someone in. If people are reading high temperatures, there are a couple things you can do. And again, I think Ambra mentioned it earlier. Creativity is really valued here. If you can figure out a way to shade an area outside your business, or is there a tree nearby that you could have employees hang out under in the shade where they could reduce their temperature, or they can sit in their car and hopefully they'll have air conditioning and that'll cool them off a little bit before they get temperature checked. Just anything where you can give them a space where they're out of direct sun, that'll help reduce that temperature to what it actually is, as opposed to a sun adjusted temperature.
And I'll give an example. I had a guest come into the chamber yesterday and we took a temperature and it read in the 99, and they were, whoa, what? 2 minutes later, after cooling off, it was 97 again. So there is that slight, especially with certain thermometers, but I didn't let, knowing it's 100.4, since it was in the 99s, we just waited a minute, let the person cool off and retested the temperature. And it made them feel a lot better too, because, saying, whoa, why is it elevated? And I'm usually in the 97s, and you saw this concerned look on their face, and it's just knowing that thermometers in this heated, environment we have with the sun, and it's July, just knowing that will help also provide some assurance to those what faces. All right, so we've heard some businesses say that people are walking in with little cards that have your logo on it, Boulder County Public Health, that say they are exempt from face masks. Is Boulder County Public Health actually issuing those cards?
No, and we will not. I think you said it really well, Corinne, in the last session. If someone doesn't want to wear a face mask, walk through the face covering script with them, see if they're willing to wear one to enter the business, and then offer them the alternatives. But no, we are not issuing any sort of exemption card to anyone.
Okay. So are we have any other questions out there from our personal services, limited healthcare, or our retail establishments that are on the call? This is the one that they always come in a little later, so I'm asking that question now while I have some last pieces. So we have some questions are there any travel restrictions right now for people going to other states, to other states, especially those states that have high incidence of COVID?
There are not any travel restrictions, either at the state or local level. I know that some other states have restricted travel from some of those hotspot states, but we have not restricted travel for either residents here or people from those states to Colorado. The one thing I can say is, if you as a business owner have an employee who either went on vacation to a place that makes you nervous or had to go on a business trip to a place that makes you nervous, you can ask them to quarantine for 14 days. Especially if there's a way for them to work remotely, then they're not even quarantining. But it's for your safety and their safety and your other employees' safety. It's a really good idea, but it is not required.
Okay, and so, because this came up in more detail in the last session, I did find a blog from some lawyers at the Employers Council that says that you should go through a decision tree when requiring those employees to quarantine and make it not appear to be arbitrary and difficult to enforce. Let your employees know beforehand that that's going to be the case, and then don't just arbitrary. Make sure it's across the board, across all employees. And I will send that link out with today. This has been a lot of questions about, whoa, Arizona, California, Texas, Florida. Those places are out of control with COVID cases. And what if my employee goes to one of those spots? What do I do? So I'll send the link out to that decision tree and some of the questions when you're requiring quarantine. We also send out to this group resources on the FERPA, the Paid Leave Act, and some of the resources that are available there. We have another question that came in. That always happens on that, so that's good. What about a client who has traveled to a hotspot? Can we ask that they are in Colorado for 14 days before providing services?
That is absolutely your right as the business owner. They can't require you to provide services.
So it's not in the public health order though. So this would be a decision made by the business owner. Yes. And again, not practicing arbitrary. If this is a decision you make, it's a decision you make for all customers and clients, so that it doesn't appear that you're showing any, you're not being arbitrary or there's any discrimination in any way. What are the current guidelines for working with high-risk, vulnerable populations for both limited healthcare and personal services? Is it allowed to work? Are they allowed to work with these populations?
I'm actually, I'm looking this up in the order right now. You can provide services to those vulnerable populations, but you need to maintain all of the things like wearing masks, both of you wearing masks. I would recommend going for the sort of stricter side of things. So if there is the opportunity for the customer to take their mask off, I wouldn't recommend that, but that's my personal opinion. That is not reflected in the order or in any interpretation of the order. But as far as I can tell, in a quick review, they're vulnerable, but it does not restrict you from providing services.
And I know on a previous call, Cammie gave some best practices, which may be you provide an hour where nobody else is in the facility, just like in retail, where they're not going to be exposed to others, getting their haircut or in the, coming in and out, maybe providing more of a protection and shield around those individuals that are high risk, in an incubated time frame as well.
I know,
off hours, for example.
In speaking with some salon owners, I've heard that's a pretty common practice, that they're setting aside hours for more vulnerable populations,
Okay.
for appointments for those times. And I think that's a very good idea.
And then in retail, there's still the requirement, Ambra, that they set aside time for, a time for vulnerable or at-risk populations, correct?
Mm-hmm.
Okay.
And then I think also with that, it's just, providing reasonable accommodations. So, if you have curbside services too, if they're uncomfortable actually coming into the store, I think that's always a good option as well.
Okay. All right. Well, at this point, I'm going to encourage the people on the call to continue to get the updates. A lot of these questions are cross-industry. We want you to get your questions answered, and we want to provide these opportunities for you to get updates, mask order updates, the newest science, things you can communicate to your customers and employees, resources that are available to you, questions to come and, or answers to common questions. So just because it doesn't say personal services or retail on the sessions now for Wednesdays doesn't mean it doesn't apply to you. So we will send out the new schedule. We'll send out the link to register for those. They are new Zoom links. So if your Zoom link should expire today if you did the calendar invites. So we'll send out that so you can register for the new series of updates. We just wanted, since there aren't a lot of order changes, to provide one opportunity. And then let's say there's an order change for a specific industry, or there is something that we need to discuss. We are setting aside special times that we'll let you know about if it pertains to your industry, because we still maintain the industry specific lists. So like I said, if it doesn't say personal services, limited healthcare, or retail, doesn't mean you can't ask your questions. My one concern about moving to a general session is that we don't want people to think it doesn't apply to them. So that will be starting next week on Wednesdays. I want to thank Ambra and Jesse for joining us. We won't see Ambra for a little while unless there's an update for retail or field services. But thank you guys for continuing to do these, to answering questions, and we're available between sessions as well if you have questions at the links that were provided. So we'll see everybody next week.
Thank you.
Thanks, Amber and Corinne. Bye.
Bye.